Hello and welcome back to ACRO's Good Clinical Podcast. I'm your host, Sophia McLeod. Today on GCP, I'm joined by Stacy Hurt, Chief Patient Officer at Parexel, and Alicia Staley, Chief Patient Officer at Medidata. Alicia and Stacy, or the Survivor Sisters, as we dubbed them on their last appearance on GCP, bring their insights as patients to this conversation about transforming the patient experience. They highlight the importance of embedding the lived experiences of patients into trial design and decision-making, why we need more holistic thinking about patients in the ecosystem, and they restate the need to engage patient communities early and intentionally. This was a really fantastic conversation, and I hope you all enjoy. With that, let's get into the episode. All right, well, we're back on GCP with Stacy and Alicia, our Survivor Sisters, who I think, did we coin that term in season 2 or did you guys come with that? I can't remember, but it's been since season 2 since you were here, so I'm really glad to have you back for season 4. It's been too long. I'm really excited to talk with you guys. I think we always have a really good conversation and I just can't wait for more. So let's get started. You both have been patients. You've both been through the patient experience, as we say. You both focus on patient centricity, and I think trying to really make that more than a buzzword. And we talked about that a lot last time, really, and what does that mean in reality? But I thought we could start off with, I think everyone wants to have this vision of a patient and the experience that all patients go through and kind of try to put it maybe in a box. And I think sometimes when you actually are a patient, some of that falls a little flat in that image that you're supposed to portray. And I know we were joking before about this idea of like toxic positivity, and positivity is good, but I think it reaches a point where we sort of ignore the realities of what someone is going through. So I thought it could be fun if we just talked a little bit about, maybe some of our favorite toxic positivity phrases just to kick folks off and really kind of ice break the episode here, so to speak. So Stacy, I'm going to toss it over to you.
Oh, well, my least favorite toxic positivity phrase is always, you got this. You got this. And I hate that because I don't got it. Going through cancer treatment, there were definitely days where, I was laying in bed, super sick, and didn't see an end in sight, was crying hysterically. And then as a caregiver for my son, there's days where I'm beat down, I'm exhausted, and people are like, you got this. And I'm like, no, I really don't. I don't think so. And don't tell me I do, because that's really paternalistic. And and to your point, Savia, it really kind of minimizes and dismisses what we're going through. And that's not a good way to help, for sure. Yeah.
I think for me, so a little bit of a change for me since the last time we talked, I guess to catch everybody up that is watching from home or listening from home. I unfortunately went from chief patient officer right back to patient at the end of last year in December 2025 with a diagnosis of a recurrence of the Hodgkin's lymphoma that I had as a kid over 33 years ago. So the little old Hodgkin's must have been hanging out somewhere in my abdominal region and decided to come back to party. And so I'm back in it, and I'm halfway through my chemotherapy. I'm responding very, very well to treatment. Matter of fact, I'm cancer free at the moment after my last PET scan. So I have 5 chemos to go. I'll finish up in May. But let me tell you, it's amazing how that toxic positivity sort of floats just as an undercurrent in the way people talk to patients. I get the same thing too. People ask, hey, how you doing? And I'm like, well, it's been a tough week. And they're like, well, you got this. And I'm like, actually, I don't. The side effects are really crushing me this week. The bone pain, the joint pain, the nausea, everything seems to be adding up. And people seem to shut down when you really start talking to them about what that patient experience really is. And, I try to think back 33, almost 35 years ago and think, gosh, were we doing the sort of the same thing even back then? And in some ways we were. It was, you get a card that says, you've got this, don't worry, be happy. That was a big phrase for a while. Or, you're so brave, you're so courageous. And you're thinking, I'm none of the above. I'm just literally trying to get out of bed every day, put one foot in front of the other, and do exactly what, my oncologist is asking me to do in terms of treatment to get rid of this disease. And I think that the whole concept of toxic positivity comes from a place of just an unknown. People really don't understand the experience unless they've been in it. And it's very difficult to wrap your mind around how hard this is, how draining it is. And, Stacy, I look to you and think, my gosh, how you were able to go through your experience and be a caregiver to your son Emmett at the same time just really blows my mind, because I know that there's some days I can't even, I can't even get out of bed. And I think, my goodness, if I had a son or a daughter that I had to take care of right now, I just don't know that I'd be able to do it. And so I think having just more empathy and understanding about how different these life experiences can be for patients is critical to really advancing what I would call the patient experience. And let's be more authentic in the way that we speak to each other. You know, the whole concept of "you've got this" is dismissive. It doesn't go deep enough to really get us to where we need to be in connecting.
Yeah, I mean, well, first of all, we should say that, Alicia, we all have that date marked, as we just discussed earlier before we hopped on here, in May. Our
Yeah.
calendars are marked in May.
May 14th, I'm
We're
done with
very
chemo.
excited.
We're gonna throw a
Heck
party.
yes.
Big party.
End of
Makers.
chemo party for Alicia.
So you mentioned, your first sort of experience 33 years ago. And I'm wondering, kind of thinking about what we were just talking about and how, this sort of dismissiveness to what a patient is really going through, coupled with everything that they need to sort of, if we're thinking about a clinical trial, like everything that they
Yeah.
need to kind of keep up with, and just sort of how hard it is, we think, to, we talk about all the time, to recruit and retain patients. I think seeing them and what they're really going through is such a big piece of that. And you both have been through your experiences over the past 30 years. And I'm just wondering, both from your personal and professional experience, how you see where we were 30 years ago to now. Have there been changes? Are there things we're still struggling with? Where are we at if we kind of take your longitudinal perspective into account here?
Yeah. The phrase, the more things change, the more they stay the same. I feel like that's what I'm living right now. It's just absolutely mind-blowing to see, in some ways, the patient experience has not changed very much at all. Matter of fact, my mom, I'm thankful that my mom has been able to even come to some of the chemos with me in the last few weeks. And the very first day that she came to the cancer center with me, she, unprovoked, basically looked at me and said, "Wow, not a lot has changed since the last time we were here." And I said, "Mom, what do you mean?" And she said, it's still controlled chaos. She called it controlled chaos, information chaos. She said before it was paper chase, everything was paper folders, pushing papers around, trying to make appointments, very manually intensive. She said they've shifted a lot online, but she said the administrative burden is still there. It's just a different form factor. And, for my mom to say that, for somebody that's not in the industry, and just looking at it in the context of me as her child going through this experience, I thought that was really interesting that the first thing she called out was administrative burden. Like what an absolute chaos it is for patients to try to deal with appointments, schedule appointments, log into the portal, missing information, information's being held back because they don't want to release reports. It's just, it's a different flavor of burden that I don't think was ever intended.
Yeah, I mean, I think it's fair to say in this podcast that Alicia has the patient experience covered. So I'm going to just speak from the point of view of the caregiver experience. And I can tell you for sure, nothing has changed in 30 years for caregivers. My son Emmett has home health nursing, and the shortage of care is apparent and real. And our insurance covers the home health nursing. And I always say to my caseworker, I say, You're not doing anything different to think outside the box, to be creative, to come up with a solution to find me care. Are you calling the colleges, the nursing schools? Are you doing any different kinds of ads? What are you doing to do something different to find me care? And it's crickets. It's nothing. And also, I can tell you from the point of view of being a caregiver for a cancer patient, I worked with a company that did augmented listening technology, and it was for the physicians. So in other words, when the patient was talking about their symptoms and their diagnosis and everything, there was this augmented technology that would capture what the patient was saying to help decrease the burden on the physician, right? Instead of like typing into their EMR, the technology would capture what the patient was saying. So I said to the company, okay, you need iteration 2.0 to be the second set of ears for the patient, because once you hear you have cancer, everything fades to black. You don't hear anything. And unless you have a second set of ears in the room, you're not processing or understanding that plan in any way. So I said, you need that iteration of 2.0 to be the second set of ears for the patient to process what's happening so we can go back and understand it and process it and follow it. I don't think they did it. As a matter of fact, I know they didn't do it. So again, right there, something that could help transform the patient experience.
Yeah, and I wonder, I think you kind of touched on this just then with that answer, Stacey, but as we think about clinical trials and patients kind of going through the process, there's been so much talk over the past however many years about patient centricity and the patient experience. And it feels like, and it sounds like from you too, things are really not changing. And so I'm wondering if we are focused on the wrong things, things that don't actually matter to patients or things that don't have a tangible benefit and improvement in the patient experience. I'm wondering if you guys have ideas, and I'm sure you do, around, what elements should the industry be focusing on instead? What do you see as things that could actually make a difference here?
Yeah, I my obvious answer is, Alicia and I are both chief patient officers, and we're still not seeing the chief patient officer concept catch on. And I'm not really sure why that is. Because until you have a patient on the inside, you're not going to make a change. There was I think a Netflix series with Ted Danson called Man on the Inside. And I like to use that metaphor to say you need a patient on the inside, because you need somebody who's a part of the organization advising you on how you're designing your products, your devices, your trials, your studies, whatever it is. And until everybody's doing that, we're really not going to make a change. So one of my calls to action is, if you have a chief medical officer giving the physician perspective, you absolutely need a chief patient officer giving the lived experience perspective. And because they're equally important. If you everybody has a CMO, right? It's kind of a mainstay, and it's like, oh, the physicians. Okay, absolutely, we need the physicians with their expertise and treating patients. But then complementary to that, you need somebody who's actually gone through it, that can speak to the lived experience of sitting in that chemo chair, of fighting with the insurance companies I was just on last week with my son's equipment company, fighting for wheels for his wheelchair that have been delayed for months. His wheelchair can't function without wheels, okay? So what was it like to fight for that appeal? What did you have to say? What did you have to do? What were the steps? No physician could have commented on that. You needed somebody who was in the trenches. So those are my thoughts.
I don't know that there's much that I can add from that perspective, because it's that administrative insanity again that seems to permeate this whole infrastructure. But what I think industry really should start thinking about is looking at this as a systemic, is like a whole across the board, right? That if you're in clinical research, you're not just in clinical research. You've got to accept the responsibility that you are playing a part in something much larger than yourself in clinical research, that you're a part of healthcare, and that we have to stop treating these different interactions across the healthcare journey as standalone or singular, because the patient doesn't look at those interactions as singular. They look at them as a whole across their entire treatment journey. And I think what happens is we get so insular in the way that we look at our little piece of what we're trying to deliver. And I'm calling out clinical research here, that we forget that there's a patient that's moving through this system very quickly in many different facets, in oncology, with their primary care, with maybe some rehab doctors, maybe a therapist. You've got so many different players coming together, and we still have not organized what that looks like. And you know what? Unless each individual transaction or transactional team steps up and says, I want to be part of a bigger equation, I want to be part of the whole, it's going to make it much harder to continue to make any advances in the patient experience. We've got to accept our responsibility that we are more than just what we're delivering, and that it's incumbent on us to make sure that what we deliver fits in to that infrastructure, fits into that journey, and it is seamless, and it's not causing friction points. And I think recruitment is the one area where we fall down the hardest, because we treat it as a very singular transactional entity. Every single time we're trying to fill a clinical trial, it's like, hey guys, guess what? We got to recruit some patients. Hey, you've been studying this disease state for 25 years. Why haven't you made connections with the patients that you're serving? Why is this like a brand new exercise every time you're trying to bring a new molecule to market? Like, we've got to get smarter at how we work in this greater ecosystem, and stop. We've got our heads down on our desks for too long, look up and go, how come there's no patients here? This is the greatest idea since sliced bread. Where is everybody? Well, because we haven't been talking, we haven't been communicating, we haven't been collaborating, we haven't been networking. And this is the way we've got to do that in order to sort of break down these barriers in this ecosystem. We've got to treat ourselves as part of a bigger equation, and not just the small piece that we're delivering.
Alicia, so much you said there was so good. I gotta double click on it for a second, because especially with recruitment, because one thing, as everybody knows, Alicia created the BCSM, the breast cancer social media community, and is a very active member in that breast cancer community. I am a very active member in the colorectal cancer community. And when we talk about recruitment, as you said, it shouldn't be transactional. It shouldn't be, hey, I'm recruiting for this trial. I need 5 patients. Can you help me? Meanwhile, there's been no trust formed, no relationship, no conversation until this point when you needed something.
Right.
Meanwhile, like you said, these molecules, these cures are being developed. Get out there and make those relationships, build that trust in those communities. Understand what their needs are, understand what their challenges are, understand what their pain points are, and design a trial to address all of those. You can do it if you spend some time and you talk to people and you listen to people and you just ask them fundamental questions about, what keeps them up at night, and then make notes of those and make sure so that when you go to develop that study, you have those pain points addressed from the very beginning. So you're not going to fall down in the middle of that study recruiting or enrolling, because you already know what's going to happen. And Alicia and I talk about, start with the end in mind. What's your goal? What do you want to get to? And from the very beginning, address those points and have that support for those patients, for those caregivers, and just support that patient experience from the beginning, of what's going to mean the most to those patients.
Absolutely.
Well, you mentioned BCSM, Stacy, and that leads me to something I was thinking about, because we talked about on the last episode how you guys met through Twitter, and the BCSM community. And I'm just curious about sort of how the community has evolved in these many years, and sort of where you guys find each other now. I think, as we've talked about, that community is so important, especially when you do still sort of feel like being an island sometimes, I think, when you're going through this process. So finding that community is so important. I know so many of you now are in industry or with advocacy groups or with sites. And so I bump into you guys a lot at conferences and things like that. So I know you guys have sort of moved off Twitter and into the real world, shall we say. But just kind of curious about like where the community finds itself now. Do you still find, that sort of connection?
Well, I guess for me, for BCSM, the community lives on, and it's not necessarily tied to Twitter anymore. It's everywhere. The incredible thing about using a hashtag to identify a community is it sort of transcends the platform that we initially started. So it's still, it blows my mind that I can be on LinkedIn sometimes and see BCSM fly by with some news about breast cancer research or a company looking for recruiting patients or finding patients. And so it's still, the hashtag is still being used. Communities are still being formed. Ad hoc communities are still being formed. There's a lot on Facebook. There's a lot on TikTok now, which I mean, it's just incredible where you find the hashtags sort of flying around, and is any platform that uses a hashtag, and basically everybody does, the community is always going to be there, which I think is just phenomenal. And it's grown well beyond what I ever thought. I thought it would be maybe a couple dozen people that I would connect with, on a Monday night on Twitter. And, we're talking hundreds of thousands of people over, almost 15 years now. And it's incredible. So the hashtag lives on, the methodology lives on, the mindset around bringing people together to talk about all these different kinds of cancer hashtags, that people are still using them, still connecting. And wherever you can have a hashtag, you can have a community. So
I want to reminisce for a minute. I just want to take a minute and be nostalgic about, what we had going on Twitter in COVID. It was unbelievable. You know why? Because it gave patients power. It empowered patients to be on a level playing field with physicians, with researchers, with those in industry, because you could have those real-time conversations. And it was great. And I want everybody out there to know, how empowering that was for us, and really what that did for us. And I think our call to action from this is to keep it going and to keep shared decision making alive and well, and to keep that level playing field. And with all of the information that's out there on the internet, you now have patients putting their diagnoses into Chat GPT. Don't know how we feel about that, Alicia. We'll put that for another podcast, but it's happening, right? And like you said, Alicia, patients are getting information from TikTok, from Instagram. So recognizing that is happening, and that patients are still connecting with each other through private Facebook groups. They are sharing information about trials. I like how everybody's like, oh, you got to keep it blinded. Well, they're talking about the trials in the groups, folks. I have news. It's happening. So I think more leaning into that, recognizing it's happening, and being more accepting of it, that they're bringing in this information and helping them kind of translate that information, either with patient navigation services, beefing that up, making sure that our communication is very clear, and actually leaning more into communication to dispel the misinformation that's out there, and the lack of facts, recognizing that it is a community of communication. It's going to come from all different sources. Patients are talking to one another, and leaning into it, and making it empower patients to lead them to clinical research, to lead them to trials more, and to lay out all of their possible options for them, because they're going to go find them anyhow. So we might as well make it more trusted and clear.
Co-sign on that. I mean, I got nothing to say. So I want to talk about this, again, kind of leveraging on your connection and the two of you kind of really getting to know each other and working together so much over these years. I've just heard that Parexel has won Medidata's award for patient leadership, which is very exciting. And this is perfectly timed for having you two here today together. So can you guys talk a little bit about this award, what it is, what you see as its impact, really anything you want to tell us about it?
Medidata runs the Medidata Next conference every year. And what we do is we try to highlight, our customers and partners that are really making a difference in different areas of the industry. And, Parexel won the patient leadership award. And it's just, I think it speaks volumes to the relationship that we're trying to carve out, chief patient officer to chief patient officer, but also look to see, are there ways as Medidata, as a software company and Parexel as a CRO, what we could be doing differently to really improve the patient experience. And I think that having Parexel, win that award just goes to show you that, there's a lot of people putting in a lot of hard work trying to improve what it means to really address the patient experience. And I think that I'll let Stacy speak to it a little bit more on that side. But, I was so thrilled when I saw the news that I felt like, all right, all the work that we've done over the last year is really, it's being recognized and being highlighted. And it gives us motivation and inspiration to keep going on the path that we're on. So
Well,
congrats.
I thank you. I'm super excited about this. So I'm going to gush about it and I'm going to tell you the whole story because it's a great story and it's one for the ages. Sophie, you talked about community and, Alicia and I, we go way back and we're friends and we're fortunate that through this partnership, we get to work together. And, it kind of all started where, you have Alicia, Chief Patient Officer, me, Chief Patient Officer, and we Parexel, we do utilize the metadata platforms and technology. And it was like, well, let's leverage our patient focus to make trials more patient friendly, if you want to say patient centric. And Medidata has a patient insights board, a group of individuals, who have great expertise in reviewing protocols and lived experience in different disease areas. And it happened to be some of the disease areas that Parexel, was focused on. And so it was really bringing our two organizations together to look at these opportunities as they come in and say, are they really as patient focused as they could be? And bringing in that patient voice to look at all the elements, to look at the schedule of assessments, to look at the technology and say, is it where it should be for patients? And if we had a friend or a family member or a colleague going through this trial, is this a trial they would want to participate in? And bringing both of our groups together, our companies together, and presenting that expertise to the sponsor. I mean, that's why the sponsors rely on us, for our advice and our counsel and our consult. And so to bring both of our companies together and enrich that through a patient lens was really innovative and exciting and forward thinking. And it really took, people sitting down, rolling up their sleeves, me and Alicia putting our heads together and saying, how are we going to do this? And how are we going to show results from it? And we did. And I'm immensely proud of our teams. And it was based on a relationship between Alicia and myself. I'm just so proud of everybody involved and so grateful to Medidata for recognizing us and for partnering with us in this realm. And
and Stacy, I want to add, not only was it like, that we put our heads together and really like focused on it, but we had a shared vision of what it could look like. And that I think is really, that really drove the collaboration and the work that we needed to do. We both firmly, wholeheartedly believe that what we could do for patients was much more than what was being delivered today. And you're right. I think it was, we had to think outside the box, but we stayed true to the relationship, the partnership, the collaboration. And we were very lucky to really see some forward movement and to be recognized for it this year. And I think if that just doesn't set us up for even more for next year.
Well, I was just going to say, I mean, to everybody else, it's just the beginning. I mean, this is just, iteration 1.0. There's so much more. Alicia and I joke about total world domination for patients, of patients, for patients, by patients. And that's always been, I love how you said that shared vision. That's always been our shared vision.
Yeah,
to see
absolutely.
it translate into action for me, Alicia, is really has been one of the pinnacles of my career so far. So thank you for that. Thank you for couldn't done it
Thank you.
without.
Golf
And I'm
clapping.
almost crying.
Yeah, no, I mean that's really amazing, you guys. I think congratulations to I know Parexel won the award, but I think congratulations to both of you on this. This is amazing,
Absolutely.
and
It's a
I'm
joint
really
effort.
excited to see where we go. And sounds like we have another podcast episode in the works. That's what I'm hearing.
Probably.
I
Yes.
bet we
Sounds,
could get
that's
It's a
what I'm
another one
yes.
out of
thinking.
this.
It's a hard
I
yes.
mean, the
Absolutely.
Survivor sisters are always ready to go.
We're all,
Yes.
but I think that kind of leads into the last question that I wanted to really sort of wrap up with, which is what is working? I think we want to, we've talked about the things that we'd like to see change and how maybe we can move towards a more truly patient at the center version of clinical trials if we really want to think about what patient centricity means.
Mhm.
Um, but I figured if we could end on like a sort of call to action type of a note to really highlight, what actually is working and maybe bring some attention to the good work that is being done, just like what you guys were talking about. How do we leverage the good stuff and kind of make it more popular, more out there? What do we got to do?
That's a good question. I think, I'm seeing a subtle shift in the way nonprofits are starting to respond. There seems to be, if you look over the last year, so yes, have a number of nonprofits shut down, closed. Unfortunately, absolutely they have. But I think the nonprofits that remain are really tightening up their vision, tightening up their mission, and getting very specific on how they want to attack some of the problems in the industry. So I think if anything, there's just a greater awareness on the need for efficiency and effectiveness in the way that we're, if we're going to be good stewards of research dollars and fundraising dollars, that we're doing it in a way that makes sense for patients. So there's a subtle shift going on there. I think, yes, Medidata and Parexel have chief patient officers. There's certainly some pharmaceutical companies that have chief patient officers now. You're starting to see more and more conversations just around what patients can bring to industry. And I think you're starting to see some of these barriers to entry for even patient consultants start to come down a little bit in recognizing the value that the patient point of view brings as part of study startup or study research. So it's good. I think there's a lot of good that's happening. Like you said, I think it's imperative on us to make sure that we're shining a light on what's working and what some of these nonprofits, what they're really doing that's making a difference. And I think that, that would be a good homework assignment for us to go out, identify some of these nonprofits and come back to you and say, hey, this one's knocking it out of the box, and here's a good reason to go talk to them.
Well, I love that. The patient advocacy groups are being completely underutilized for what they can offer to the space. They know who the KOLs are, they know what the key sites are, they know what the patient needs are. So just again, I want to reiterate what Alicia said. And speaking of which, we're recording this in March, so I would be remiss if I didn't say it's Colorectal Cancer Awareness Month. Call to action is get screened. If you're 45 and older, talk to your doctor about your screening options to be screened for colorectal cancer. So that's number one call to action. Number two, it's March. We're recording this, and it's Women's History Month. And I just want to give a shout out to Alicia and show you that when women work together and support one another, what can be done. And that goes to you too, Sophia, and the great work that ACRO does. So thank you so much for that. That's number two. And number three is I think that people have to form more partnerships like what Medidata and Parexel have done and break down these barriers to just working together and collaborating in the industry. I did a post on LinkedIn that went viral about being called a vendor, and I hate that word, vendor. I like partner because we're all part of this ecosystem. And this gets back all the way to the beginning that when you use the word vendor, you are minimizing someone's value. And when you look at them as a partner, and this goes to Alicia's point about the patient advocacy groups, when you look at them on an equal playing field and what they can bring to your overall program success, you'd be surprised at, when you sit down and have those conversations, the expertise, the intel, the experience that can go into through collaboration and how it can make the whole thing better. And Alicia, you said that earlier too, about really, looking at the whole picture and the longitudinal view of the experience. If you tap into the expertise of all of your partners, you would be amazed at what can be accomplished. And it just takes a conversation, it takes some hard work, and it takes a shared vision, like you said. So,
Absolutely.
yeah, let's do it.
Couldn't have said it better myself. Really kind of a plug for Acro, Stacy. I mean, we're all about collaboration, so that was great. I should thank both of you, obviously, for taking a little bit of time out of your morning to talk with me. It's always so fun getting to talk to both of you. Alicia, we will be toasting to you on May 14th.
Send my friend strength, because she might not necessarily got this. And
Yeah.
everything does not happen for a reason, by the way.
Thank you both so much. This has been great.
Thank you.
Thank you. Thank you. It's been a pleasure.
Thanks so much for tuning in to Acro's Good Clinical Podcast. We'll be back next week with a new episode.